Sickle Cell Anemia in the United States by Sara Engle, Bibiana Perez, Colleen McKnight, Hannah Dejesus, and Destiny Polk. Sickle cell anemia is the most common form of sickle cell disease. The term sickle cell describes the crescent-shaped red blood cell. To be diagnosed with sickle cell anemia, one would have to inherit two abnormal copies of the hemoglobin gene from both parents. It has been present in Africa for at least 5,000 years, and it affects millions of people throughout the world. It is particularly common among those whose ancestors came from sub-Saharan Africa, Spanish-speaking regions in the Western Hemisphere, Saudi Arabia, India, and Mediterranean countries such as Turkey, Greece, and Italy. Sickle cell disease occurs more often among people from parts of the world where malaria is or was common. It is also believed that people who carry the sickle cell trait are less likely to have severe forms of malaria. Approximately 1,000 babies are born with this every year in America. About 1 out of every 12 African Americans have sickle cell trait, and 1 out of every 100 Latinos has sickle cell trait. The United States estimates that sickle cell anemia affects 90,000 to
One of the most
100,000
common risks of
Americans.
sickle cell disease is cerebrovascular accident, also known as CVA, is a catastrophic complication of sickle cell disease and a leading cause of death in both children and adults. CVA is otherwise known as a stroke, which is damage to the brain from a mishap of its blood supply. Because sickle cell disease causes blood to coagulate, the blood in the vessels of the brain can get too thick and cause a blockage. Other risks from sickle cell disease are retinopathy, mental retardation, pulmonary infections, pneumonia, infrax of the extremities, ulcers, bone marrow hypoplasia, and congestive heart failure. Pulmonary hypertension is defined as being high blood pressure that affects arteries in both the lungs and in the heart. What seems to be the most painful complication of sickle cell disease is pain episodes or crisis. The periodic, self-limited episodes of excruciating musculoskeletal pain punctuate the lives of patients
Since
with
there is
sickle cell
no
disease.
cure for sickle cell
The
disease,
pain
patients
episodes are
and families
caused when
have
there is a
difficulty
shortage of
coping with the
oxygen
side effects of the
reaching body
disease.
tissues
One of
with the
the reasons that
crescent-shaped
pain is
red blood
associated
cells.
is because of the negative mindedness of the person, either from their own thoughts or family's influence on their thoughts. If the person changed their mindset, they would be able to cope and deal with the symptoms appropriately. In an adult experiment, adults with sickle cell disease who receive mental intervention show more active copying and less negative thinking than those who receive no intervention. Cognitive exercise helps reduce pain periods and lowers the reduction in daily activities. The techniques associated with the cognitive behavior approach help reduce anxiety, self-reported pain, and medication use. Some additional copying skills or modify behavior to help increase confidence in the ability to control the experience associated with the pain, and social support interventions where the use of other positive influence can help someone deal with sickle cell disease. Sickle cell disease requires long life treatment starting a few months after birth. By 3 months of age, complications from the disease may appear to be developing. Anemia is usually seen by 6 months of age, and it becomes more severe over the next several months to years. The United States screens all newborns for the hemoglobin synthesis to identify children with sickle cell disease.
The following treatments are presently being used with success in lessening the overall effect that sickle cell disease has. Children are given prophylactic penicillin as a means to prevent early fatal pneumococcal sepsis until at minimum the age of 5. Along with the normal series of childhood vaccines, they are also given the PPV-23 vaccine at the ages of 2 and 5. The MCV-4 vaccine is given at age 2, and they receive a yearly influenza vaccine. Other treatment options include hydroxyurea, a medication that affects the bone marrow and was originally used to treat certain cancers. It has shown to play a significant role in reduction of the complications of sickle cell disease. It has reduced the frequency of acute chest syndrome, which can be fatal, by half. It may help prevent an initial stroke in children or prevent them from having another. Hydroxyurea therapy is useful to prevent vaso-occlusive pain crisis events. Transfusions are needed less often as a result of hydroxyurea therapy, and hospitalization can be avoided more frequently. While hydroxyurea has emerged as a major therapeutic option in the management of sickle cell disease, transfusion remains an essential and life-saving component of clinical care. It increases the amount of red blood cells the body has and lowers the amount of hemoglobin S cells. This decreases the blockage in the blood vessels and also increases oxygen supply in the body.
For the continued use of blood transfusions, risk of developing large levels of iron in your body increases. This needs to be treated by chelation therapy, use of a medication that binds to the iron and moves it from the blood via the urine or stool. Chronic transfusion therapy may cause someone to develop antibodies to donor blood, a condition called alloimmunization. You also run the risk of infection from blood transfusion. The other option available for treatment and the other cure for sickle cell disease is hematopoietic stem cell transplantation. There aren't many donors available for this. The best and safest is a sibling donor, and even this isn't without possible complications. There is the risk of graft rejection as well as graft versus hot disease, where the recipient's body is viewed as foreign by the transplanted cells.
On the chart, there is an approximate number of people in the United States with sickle cell disease from each ethnic group.
Sickle cell disease is a blood disorder that is inherited from both parents. This disorder is more common in certain ethnic groups, such as African Americans, Arabs, Greeks, Italians, Latin, and Native Americans. Normal red blood cells are very flexible and are circular in shape, resembling a donut. Their flexibility and shape allow them to travel freely through small blood vessels called capillaries. In persons with sickle cell disease, the red blood cells become crescent or sickle shaped and also become inflexible. The abnormal cells stick inside the capillaries, blocking blood flow to vital organs. Persons with sickle cell anemia can have symptoms such as yellow appearing eyes and skin, pale skin, delayed growth, bone and joint pain, increased risk for infections, development of leg ulcers, eye damage, anemia, and damage to the organs affected by the obstruction.